Okay, so we're just going to start in a minute. We're just waiting for people to join us. So welcome to the webinar if you've just arrived. We're going to wait half a minute, and then we'll start. Okay, so I think there are a few people joining, so I'll sort of start quite slowly. Welcome to the webinar. I'm not sure what's happened there. Apologies. Welcome to the webinar. So I'm really delighted to be able to welcome Rachael Tarlinton from the University of Nottingham and Mark van der Heijden from the University Farm Animal Department in the Netherlands. I'm Fiona Lovatt, Flock Health Limited, and also University of Nottingham and RCVS Knowledge. And so I'm chairing the webinar, and we're really pleased to welcome you all here. So we're recording this webinar and we'll circulate it within 24 hours. So if you miss bits, if you have to jump out onto a call or whatever, no worries, you'll be able to catch up later. What we're going to do is I'm going to introduce, Rachel's going to speak a bit, and then we're going to hand over to Mark. And there's then an opportunity for anyone to ask questions. You can put questions in the chat box. There's a little icon in the top right hand with a question mark in. You can put your questions in the chat box throughout. We will answer whatever we can at the end. We can't promise we'll be able to answer everything. We'll do our best. And then you'll be given a feedback form at the end of the webinar, and we'd be really pleased to get your feedback both on this webinar but on topics that you'd like us to cover ahead. So I wanted to just let people know about the Bluetongue Resource Hub, which is the Ruminant Health and Welfare Group have pulled together. That group's been meeting a couple of times a week since December, so that we're prepared to deal with bluetongue. And there is a hotline as well for farmers and for vets. So please do access those hotlines. There's also, we're well aware that this is quite a stressful situation, potentially for both vets and for farmers, and there are links of additional support available if people need it. I'm not expecting you to be able to write all those down now, but just bear in mind those all those contacts are available via the Ruminant Health and Welfare Resource Hub, or come back to look at the recording of the webinar, or don't be left without somebody to talk to if you need to talk to someone, or if you need to point your clients in the direction of somebody to talk to. There's links on there. So we set up this webinar following on from an article that Rachael and myself and Margit wrote, and it was published in Practice last week. So that resource is there, and it covers treatment considerations for Bluetongue virus if and when we have active infection in the UK. But we've invited Margit couldn't attend today, and she suggested Mark, who's been in the thick of the outbreak in the Netherlands, and we're just delighted that Mark's here to be able to share his insights with us. So as a sort of reference point, do go back to the article, but today you'll be hearing firsthand from Mark's experience in the Netherlands back from the autumn. So yeah, use that as a reference point, but today we're here from Mark. So just, and I've copied these out of that article. Bear in mind, currently in the UK, we don't have bluetongue, and it is a notifiable disease. And so very clearly, there's actions you have to take if you suspect bluetongue in any client slots. There's details, there's numbers you phone in England, Wales, how you contact people in Scotland, and we are really keen that vets and farmers remain vigilant, monitor animals, and the APHA and DEFRA, where everybody is poised so that we pick things up quickly, and that's the role, responsibility of each of us. So that's an important box there. Obviously it's in the article, but you can find those details on the Ruminant Health and Welfare Resource Hub. And I put that picture in there of the Netherlands. I know that Mark will end with that, but that was a situation at the end of 2023 of the number of infected premises in the Netherlands. That's how quickly, how thoroughly BTV3 took hold in the Netherlands in the space of a couple of months. So the red dots are PCR positives, and the blue dots are clinically positive animals. So that's kind of what the Netherlands faced, and we'll come back to that. I know Mark is going to fill us in on the grim details. But before that, I'm just going to hand over to colleague Rachael Tarlinton, who's a virologist at University of Nottingham, and Rachel's going to fill us in on some of the other important bits to note.
Thanks, Fiona. So this is just a couple of slides with just a brief update of where things are at the moment, particularly in the UK. So we had a number of cases last autumn. Those animals were picked up through serology monitoring. Most of them were cattle. A very small number were sheep. They were originally culled. As it got colder, obviously transmission drops off and stops because it's a midge-borne disease, and most of them were picked up later and weren't actively infected at the time. So they were infected in late autumn before it got cold. The position we're in at the moment, though, is we're now out of the vector-free period, so the midges start breeding again. We haven't seen new cases so far, either here or in Europe, but we wouldn't expect to until later in the summer. The cases generally start to become detectable as the midge numbers build up because it's midge-borne. The APHA have released their most recent risk assessment very recently. And there is a link to that there. I'm just going to stop for a sec because there's a plane going over. I'm at Sutton Bonington. I don't know if you can hear that or not. It'll be gone in a second. There's a problem with the vet school. We're under the flight path for East Midlands Airport. The APHA risk assessment is there, and I would strongly recommend going and having a read through that. There is a very high risk of there being an outbreak in the UK this year, but there's a huge amount of uncertainty as to when that will happen, exactly where that will happen, and how large that outbreak will be. And there's an awful lot of things that are very uncertain in when, how far, how wide. What is clear from the modelling work that's been done is if we're going to introduce control measures like we had last autumn, they'll only really be effective if the outbreak is picked up in early summer and is reasonably small still. If it's large or later in the summer, it will be in essence too late for any control measures to do anything, and that's partly why there's so much uncertainty about what's going on. So we can move on to the next slide. So the good news is there are 2 vaccines that have emergency authorization in the Netherlands, and Mark can tell us a bit more about that later because they have just started using those in the last week. These are killed and activated vaccines. They are the same as the existing platforms and vaccines for other BTV strains. So all the things that apply to those, the dose rates, the administration, the timing of them, are the same as the already registered vaccines. However, these are not available in the UK at present. They've not been through the registration process and assessment here. We've been informally told that at least one of the companies is planning to do that, but we don't know any more than that. What is clear is because of the time that process happens and all the regulatory stuff that has to happen, it's unlikely to be available in time to make a big difference in the UK this summer. A lot of the uncertainty at the moment, or what will make a difference, is really what happens with the outbreak size and intensity depends very much on that vaccination effort in the Netherlands and surrounding countries right now in early summer, because that is the best chance to keep the outbreak small, and that's really critical right now. So that's it from me with as much information as we have. So I'll hand back to Fiona.
Just before we hand back, Rachel, can you just you suggested to me earlier that there's logic, even though clinical signs are worse in sheep, there's logic in vaccinating cattle. Can you just explain that,
Yeah.
please?
So while the disease is much worse in sheep, their mortality rate is much higher. The amplifying host, the host in which the virus replicates more efficiently and spreads to and from the midges more efficiently, is cattle. So to actually reduce the size of the outbreak and stop it spreading, it is vaccination of cattle that is really critically important. Even though we do see disease in cattle, it can kill them. We do see severe disease in some cattle. It's sheep that are worse affected, but for controlling the disease, it is cattle that are the really critical species for that vaccination campaign to actually stop it.
But just to clarify, we do not have any of these vaccines available in the UK, and we may not get them. There may be trade reasons, there may be all sorts of reasons why we don't get vaccines either in time this year or indeed even this year. So that's just to clarify to the audience. The reason we're talking about treatment, we're talking to vets about what they can do if we have active bluetongue infection circulating in the UK, and we shouldn't be sitting here thinking, don't worry, we'll just vaccinate, because that's not a possibility at the moment in the UK, is it?
No, it's not. And that's out of nearly everybody's hands at the moment, because there's a huge number of things that have to happen for that to happen.
Okay, that's great.
They are working as hard as they can at the VMD in places like that, but the process has to happen.
Okay, thank you. So now we'll go across to Mark. I'll just stop sharing my screen, and so as I said, Mark works. I'm going to let you introduce yourself, Mark, and share your slides. Thank you very much. Yeah, that's great. We can see your slides well there, Mark. You just need to unmute yourself. Can't hear you, Mark. Can you the microphone at the bottom of the screen? In the middle.
Fiona, but Mark's still muted.
Yeah, in the middle at the bottom of the screen, Mark. Can you see?
I think so. It's okay.
Now we've got it.
Perfect. Yeah.
Yeah, I have to share my screen.
And now you just need to share your screen again. Yeah.
And if everything's okay, you can hear and see me, or not?
Okay.
Okay. Now, thank you for the invitation, Fiona. First, I want to give a short introduction of myself. My name is Mark van der Heijden. I'm graduated in 2003 in Utrecht. And I started, my first job was also at the university in the large animal practice with students outside. After 3 years, I went to a private practice in Harmelen. That is the practice nearby Utrecht. And I'm working there with four large animal vets, and I'm also have worked in horses for 3 years. And since 2009, both practices have merged into the University Farm Animal Practice, ULP in Harmelen. And so we also have students who we teach in the last stage of their study in their veterinary study. Nowadays, in our practice, we're working with 13 ruminant veterinarians and 2 swine veterinarians. And within the club of veterinarians, we have further specializations. In general, everyone is a ruminant of the 13 veterinarians. Everyone is ruminant veterinarians in general. And within that, there are specializations among the colleagues. And so I'm working a lot with sheep and dairy goat farms. In our practice, it is 3 dairy goat farms. The smallest one got 150 animals and the biggest one 1,200 animals. We've got 300 sheep farms, also varying from 2 or 3 animals per farm to 200 for the large one. And also we have 30 petting zoos in our practice. For my hobby, I have 20 blue Texel sheep before the BTV outbreak. I will tell you later. And in 2019, I started an alternative residency for European College. Now, what was the start with BTV infection in the Netherlands? Now, Sunday, 3 September last year, 2 vet practices report Bluetongue-like symptoms to the State Veterinary Office and AHDB Kijker. That's the monitoring institute in the Netherlands. And it was 40 kilometers north of our practice, I think 30 or 40 kilometers. One day later, the 5 sheep flocks are visited. In all herds, clinical signs in sheep are observed. And in 2 farms, there was also cattle present, but they don't show any sign of BTV. The samples were sent in for further investigation to the WBVR. And a couple of days later, they showed it was BTV3 in the Netherlands. Here you see the map of the Netherlands. It started with the 3 of the 4 cases. As you can see in the red dots in the middle part of the Netherlands, and our practice is a little bit below that. And a couple of days later, on 7th of September, we've got also the first case reported in our practice. In my situation, it was blonde Aquitaine cow with some signs of sunburn, but when you look further to the animal, you saw some lesions in the mouth and also some fever, a tucked up abdomen, and we suspected it was also BTV, and so we did also our report to the State Veterinary Office. The first week there were a lot of cases each day, and after 7 to 10 days there was a kind of an explosion in our practice of BTV cases all over. And it was still going on till the end of October. Now, I will focus on the clinical signs in sheep in this presentation. The most important things we saw the first day was salivation of the animals. Most of the sick animals isolate themselves from the flock. Fever was seen in some animals, but not in all the animals. And after a few days, we saw also lesions on lips in and around the mouth, as we know of BTV infection, a tucked up abdomen. And most animals had signs of dyspnea, nasal discharge. And after 7 to 10 days, we saw a lot of lameness in several flocks. And we don't know what other residual problems were in those flocks. Now I have a case in my own flock, unfortunately. This was our ram for mating. He has to be mated 2 weeks later, but it was the first one who got sick in our flock. And the first day it was standing alone, apart from the rest of the flock. It was salivating. You see a little swollen head, also swollen eyes. That was the first sign. So we decided the first day to treat him with painkillers and antibiotics, and the second day we thought, hey, it's a little bit better. But after that, it's becoming worse. After 3-4 days, we saw the lesions in the mouth, especially on the border of the skin and the mucous membranes. As you can see in these pictures, and also in the one of our ram, and you can see the reddish color on the palatum, the lips, and also a lot of salivation of the animal and swelling of the head. 1 week later, after start of the first clinical signs, this was what was left over of our ram. It was horrible. And at this moment, we decided to euthanize them, and he was sent in for pathology. Some animals survived the first week, and also a lot of clients in our practice thought, hey, we've won the situation, and and we're happy to have still the animal. But after 7 to 10 days, we saw a lot of lameness in different flocks, and also in our flock. There's another sheep, a ewe, who was had a very problems with the BTV infection, and after 1 week, she was lame, especially in the front legs, and the picture in the right on the right side is from another sheep, also in our practice, but it was a common situation in several flocks in our practice. Another thing we saw was, beside the lameness, was also some problems with the claws, and as you can see on the right picture, there was irritation in the interdigital area, and when you look further, we saw some signs of de-hooving, de-shoeing of the claws, and it was horrible. In one of our animals in our flocks, we had also a situation, and I had to plan to amputate one of the claws to hope it will be correct for the animal, but unfortunately also the other claw in the same leg was infected, and also that animal we decided to euthanize. And in a total period, we started in our flock with 20 animals, and there were 5 left after the period in the autumn. It was horrible, and it was also the situation on most of the farms in our practice. A lot of mortality, till to 70 or 80%. What did we do? In the first stage, we didn't know the exact treatment of what was good for the animals and what we can advise to the farmers. So we started to give all the animals painkillers, think of NSAIDs, fluid therapy. Dus we put a lot of fluid by syringes into the mouth to ensure they will take up some fluid. Antibiotics to prevent secondary infections or to help to treat them. Forced feeding with some concentrates. Another advice we gave in the practice was housing animals inside. And we did it also on several farms. On one farm, housed them immediately after the first signs inside. And we saw in the first 2 weeks that there were still new animals suffering the disease. But after that, it became quiet, and there were not new BTV infections in the barn. And the discussion in the practice was, what was the moment when we talk about unbearable suffering and we have to decide to euthanize those animals, especially when they survived the first stage in the 7 days with the lesions in the mouth and so on. But when the lameness was increased in some flocks, you have to decide and talk to the owner. It's much more better to euthanize those animals in case of welfare. Now, the discussion in the first week was also the use of NSAID, especially of the use of metacam, meloxicam in sheep, and also the dose we have to use in those animals. And in discussion with the pharmaceutical industry and also the faculty in Utrecht, we decided to treat the animals frequently with NSAIDs and in a dosage of 1 milligram per kilogram body weight. And there was a discussion if we have to do that every day or every 48 hours. So we tried several things in the practice, but the idea was nothing worked directly or had a good result. So it was disappointing, the result of treating those animals. Besides the NSAIDs, we also use antibiotics to prevent the secondary infections, and it was also the first practical advice in our practice. So we decided in our practice to do for all the vets the same treatment, of the advice of the same treatment for the clients. The third point was rehydration, drenching animals when they were not allowed to, when they are not drinking water by themselves. Feeding the animals with concentrates, small amounts all over the day, housing the animals inside, and avoid stress. In the meantime, the first animals who died due to BTV were also sent into pathology to the GD, the Animal Health Service. And I'm sorry for the text in Dutch, but I have to translate it also in English. And the first phase was that 12 sheep were submitted for postmortem to GD to see what also the pathological findings were in those animals. And we saw a lot of problems, a lot of mess in those animals, such as erosions, ulcerations on lips, tongue and oral cavity, edema all over and multiple bleedings, severe pulmonary edema, extensive ulcerations and hemorrhage in the rumen pillars. That was a remarkable sign what we saw in those animals. And at the same time we had also the situation in cattle in our practice. It seemed to be like vomiting of those animals, and maybe there's a relationship between all the damage to the rumen and rumen pillars to explain the vomiting of those animals. There's also some hemorrhage in the heart muscle, and the last point, we saw also extensive tubular degeneration and vascular damage in the kidneys. You got some pictures. At the left side you see the rumen content and also the area of the pillars, but you can see in reddish color. And at the right side you see the pulmonary tissue, and in the left corner that is normal lung tissue, and on the right side you see the damaging of the alveolars and also the lungs, including a lot of lung edema. After these findings, we decided together with the Animal Health Service, the faculty and also our practice to write an assessment framework for the treatment of sheep with BTV. So in the meantime, there was a lot of treatments all over the Netherlands, all over the different practices, and we tried to give a general advice what the side effects or the good effects are of the different drugs we can use to treat those animals. So we make a short notice about the drugs I mentioned here. And at the end, we have also a paragraph over euthanasia. And after we've published it into the Netherlands, we have the discussion. Maybe we have to do the arguments about euthanasia as the first argument, because we saw a lot of problems. And maybe is that the most important thing to discuss with the owner? When do we have to euthanize those animals in case of welfare of those animals? But to the different drugs we can use, on the first place, the corticosteroids. We thought it was positive to use them, especially also to prevent the damage on the lungs. It is known that it is working on lung tissue, and it had some benefits in preventing more damage on lung tissue. So that was the step we advised to use the corticosteroids in the acute phase animals with BTV. Then on the second time, the NSAIDs, and we divided it further in meloxicam and paracetamol. The first one was the use of NSAIDs. As I told earlier, we use a lot of NSAID in the first stage of the BTV infection. And after the findings with pathology about the damage in the renals, we had a lot of discussion. Is this due to the use of NSAIDs or is it due to BTV? So we know that also BTV can cause a lot of damage in renals. So it was not clear what the origin was of all those damage in the kidney. But we decided to be not so, how do you tell, sorry. We want to restrict the use of the meloxicam in sheep. On the other hand, paracetamol was also described in several studies, I told you later, and so we decided to start the treatment of BTV infected animals with meloxicam and continue it with paracetamol. The third one is the antibiotics. In case of a viral infection, there's not directly use of antibiotics is necessary, but due to secondary infections, we advise to use the antibiotics in those animals infected with BTV. Diuretics. There's not very much known about the use of diuretics in food-producing animals. There are sometimes used of furosemide, and in acute phase we advise that, but I didn't see many positive effects of treating those animals with diuretics. And the next one is antihistamines. We know as antihistamines will release from mast cells, and it's unclear if it's also normal in an infection with BTV. And on the other hand, the side effect of antihistamines is also that it influences the permeability of vessels. And we know that BTV infection causes a lot of damage to vessels. Thus, I think it is doubtful to use them. We did it in our practice. And the last one of the drugs was the antiviral drugs. We know that from the human situation, but there is not many known of these drugs in the veterinary world, so we didn't also use these drugs. And the use of paracetamol, there was a lot of discussion in the Netherlands. In the first place, there is less knowledge about paracetamol in small ruminants. We are lucky because it's also on the MRL list, so we can use it in food-producing animals. And there are also some studies where they have investigated the role of paracetamol. And one of the studies described that sheep can metabolize paracetamol, essential when we have to use it in those animals. In goats, the pharmacokinetics of paracetamol has been researched, and we say often there's a similarity between sheep and goats, so we use also that information of the goats into the sheep, and so we decided to use the paracetamol also in sheep, and in a practical way it was 3 times a day 10 to 20 milligram paracetamol per kilogram body weight. There was also only the discussion what kind of product you use. There is a product known in pigs or in swine, but at the time of BTV it was not commercially available in the Netherlands, and we decided by use of Cascade to use the product we also know what can be used for humans. So we treat those animals in our practice with paracetamol. And that resulted in a second practical advice on 13 October, 2 weeks later than the first practical advice. And we treated the animals according to this protocol. On day 1, we gave them meloxicam in a high dose of 1 milligram per kilogram body weight, and together with corticosteroids. From day 2, we treat those animals 3 times a day with 1000 milligram paracetamol. It's the same situation as 2 tablets of paracetamol 3 times a day. We advise to give them antibiotics, and further the other advices as you have seen before, such as rehydration, feeding the animals with concentrates, housing animals inside, and to avoid stress. I've also looked for the situation in our practice, and we use in our management system a special code when we do farm visits, and we use the code sheep sick. In Dutch is dat ziek schaap, but when I saw these results, I'm afraid that not all of my vets, of all of my colleagues, use the same goat, of the same code. And so I think the results are much more lower than in the practice. But as you can see too, the differences all over the different months, you can see there's an increase in sick animals, especially in the months September and October last year. Another thing I've get out of the management system was the number of sheep euthanized last year, and normally it is around 10 animals at the max in a month, especially in the springtime. I think due to the lambing season, but you can see an enormous rise in the autumn last year, especially in October when we've got 110 animals euthanized by one of my colleagues. And these are the animals where the farmer called us to euthanize, but in the meantime a lot of sheep died by itself. It was enormous in our practice. I've also show you some maps during the whole period, and I will click them quickly, but you can see the different dots all over the Netherlands and becoming more and more every week later. And this was week 2. So in the first week we've got 4 cases of sheep. In week 2 we've got also some cattle. And you can see every week later there were a lot more cases. There's in week 3 also 1 goat. Week 4 also alpacas and llamas. And so on. And even 1 mouflon was test positive in week 7. And you can see all over the Netherlands, except in the southern part, you see the different dots of positive tested animals for BTV3. And I think this is almost the same map as Fiona showed you. Now, is there a solution? Now, we are lucky in the Netherlands that we have a vaccine available. 2 weeks ago, the first vaccine was available, and last week the second one was also reported to coming in the next weeks. At this time, since 2 weeks, we are very busy in our practice to vaccinate the sheep. There was a lot of discussion which animal have to be vaccinated first. I was interested in the discussion before my presentation because of it's most likely to vaccinate the cattle at first. But in the Netherlands they decided, I think due to also emotional things and a lot of problems we've seen in sheep, is the first step to vaccinate all the sheep, and after that we will also vaccinate the cattle and even the goats. But now at this moment in our practice we're vaccinated a lot of sheep, and I hope we can start to vaccinate the cattle after next week. The big question, I think, is still what was the origin of BTV3 in the Netherlands. We didn't know it, but I hope that I have shown you the situation in our practice in the Netherlands, and was wondering if there were some questions which I can answer. Thank you.
Mark, thank you very much. That was really great to see. Not nice to watch, but we really appreciate you sharing those slides, especially distressing when it's your own flock that's affected as well. We really appreciate that. I have got a slide to share with some of the information we put in the article about the NSAIDs and the accessibility of paracetamol in the UK. In fact, I might just quickly share this slide. which summarises pretty much as exactly as you were saying, Mark. So that you originally were using that meloxicam at 1 mg per kg, 1 mil per 20 kilos, and then you were reducing it following that, but that you quickly decided to have a lower dose than that. So in your talk, you just said you were using meloxicam just for the 1 day. That's correct, isn't it?
Yeah, that's correct. Yeah.
We've contacted, it's Seva make the Pracitam, which is the pig paracetamol, and they do have some Pracitam available. It would be available in the UK, but not in massive quantities. We've taken what you suggested for sheep, and we think that's pretty much equivalent to the dose on the packet for pigs. It's administered in water, which we had a debate as we were writing the article with Margit whether that's a good thing, because the animals often put their faces in water, don't they, Mark, when they're distressed. The only thing is whether they actually are drinking it or whether they I don't know. I can't decide whether that's a good thing if you've got painkiller in the water, or whether they're actually going to take in that. So, and if we don't have enough Pracitam available, then on the cascade, UK vets can prescribe human tablets the same as you were in the Netherlands. So that's 2 crushed 500 mg tablets given 3 times a day for a sheep. And then the dexamethasone.
Sorry, Fiona, the paracetamol was supposed to be on a veterinary prescription. The farmers legally can't just go to the supermarket or the pharmacist and buy it. They have to have a vet's prescription, and the supermarket won't sell them more than 2 packets anyway. We spent some time discussing this with the VMD, so they were happy with the advice in the article.
Well, it's the same situation in the Netherlands. We've got also the discussion of where they can get the paracetamol.
Where they can access it.
But there are also farmers who went to the drugstore, the human drugstore, to get the paracetamol. But yeah, our advice was to get it in our practice.
Yeah. And you said you did use antihistamine. You had farmers going in to also buy antihistamines, I think, didn't you, in the Netherlands?
Yeah, there was a study done.
Sort of panic mode.
There was a study done by Market on the faculty, but I don't know the exact results. But there was no difference between the animals treated with antihistaminics and yes or no.
Yeah, we certainly put that in the article that there was no evidence to show the antihistamines were effective. And actually, that's quite important that people don't get the idea they can go and buy antihistamines if it's not going to make any difference. Yeah, and then finally dexamethasone. The suggestion once a day for up to 10 days came from COVID patients, I think, didn't it, Rachel? That
the pharmacological argument is the same as for COVID, because what we see in the sheep is a similar pathology. It's like a cytokine storm or a hemorrhagic fever type symptom, and dexamethasone in the early stages of disease, if it's really severe disease, can be really effective for a whole variety of diseases. Most of the work's in people for decreasing that cytokine storm and increasing survival rates. So it's a reasonable thing to do. There's no actual clinical trials in sheep, but it's a reasonable thing to do. But in ruminants, it will induce abortion at the wrong dose rate. So you have to be quite cautious about the use of it, or just using it indiscriminately. You're getting the dose rate wrong because you may make things worse. But there's a good argument, and they used it in the Netherlands, and I think, Mark, you found it, at least anecdotally, helped, and there's a good rationale for using it.
Yeah, but I think your overwhelming message, Mark, and Margit said very much the same thing, was really early on to consider euthanasia. Especially that sloughing of the hoof a week or 2 afterwards, and some of the long-term consequences of animals that have recovered that initial acute stage. you often ended up putting them to sleep a week or two later. That's correct, isn't it?
Yeah,
So
that's correct.
yeah, very, very difficult. So thank you for that. I'm going to stop sharing my screen because I've got a number of other questions that have come in. So firstly, someone's asked whether we've seen any clinical signs at all in the outbreak that we had in the UK last autumn, and I think the answer to that is they picked it up in some cattle, and it's often subclinical in cattle. There were no clinical signs seen in any cases in the UK back in the autumn. That's correct, isn't it, Rachel?
As far as I know, though, those animals will have been at pasture at the time they were infected, and it may not have been picked up. There were a small number of sheep, very tiny number of sheep, and it was right at the end of the season, so the dose rate in the midges and the replication may not have been as high as it would have been otherwise. So Chris Saunders presented in one of these webinars a couple of weeks ago a experimental trial they did at Pirbright. So they did recover infectious virus from at least one animal and used that in an experimental infection. So it is the same virus as in the Netherlands, and the pathology they saw in the experimental study in Pirbright was quite severe. Like I think it was 3 out of the 5 animals had to be euthanized on welfare grounds. So it is the same virus. It does cause pathology. It causes very severe pathology. And there's another question as to whether the pathology of this is worse. Its pathology of Bluetongue strains varies a lot, but this one is very severe. So I guess the answer to that is yes.
Yep, thanks, Rachel. So I've got a couple of questions here for Mark. Initially, what clinical signs and gross lesions have you seen in camelids and any other ruminants in cattle, sheep, or goats?
Yeah, I've got one case in our practice with camelids, and the only sign we saw was some fever and nasal discharge.
Okay.
There was very little signs compared to the sheep, but there are some cases in the Netherlands who described a lot of mortality in camelids. That was not the situation in our practice.
Okay. Yes. Sheep, mainly sheep though. So goats, cattle, and camelids all much less signs. It's mainly the sheep where you saw the big clinical signs.
Cattle I wouldn't say, because there's a lot of variation in our practice. We've got some dairy cattle farms with a lot of problems with BTV. I've got one of my own farms was housing before the BTV outbreak his animals inside during the day and go to the pasture due to the heat and so on in the evening and night. After the first signs of BTV, he switched it off. But there were a lot of problems in those herd. It was a couple of 140 animals, and I think 50% of those animals are infected or had the clinical signs of BTV infection. It was horrible.
Yeah.
Dus they have to bring for a week, 10 days, the half of the 70 animals every day to the milking parlor because they want to do it by themselves. It was horrible.
Yeah. Okay. Yeah. Horrible.
Yeah.
The question here is what antibiotics did you use? Certainly in the article we suggested either just a penicillin or oxytetracycline just to cover them because of the compromised gut and sort of leaky cells. What were you using, Mark, in your practice?
And most of the antibiotics we used was penicillin.
A penicillin.
We prefer in our situation the Albipen because it's easy to use once in 48 hours. So that is much easier for the farmer to treat them.
Mm-hmm. And you are basically covering them for secondary infection.
Yeah.
Yeah. And did you dissolve your paracetamol, or did you give them the oral tablets? Did you dissolve that paracetamol in water?
No, we used the tablets in general. We've got a little applicator where we can put them in, and also we use them to give them to the animals. The same applicator sets which you can use for some deworming products.
Okay, thank you. And how many days of paracetamol typically did you give? Was it until they recovered?
It depends on the situation. When they're not becoming lame, then I think for 1 week they will get some paracetamol. But when there are other problems such as lameness, dehooving, and so on, yeah, then you have to discussion for how long you have to treat your animal, and it's not better to decide to euthanize them.
Yeah. Okay, look. Sorry, just trying to work through all these questions. Have you seen any incidents of teratogenic effects on calves or lambs with BTV3? I know that was theoretically a possibility.
For me or not?
But
Yeah.
yes,
Yeah.
have you seen any effects on calves born?
No, I didn't see any effect in sheep, but I think most of the sheep who are infected with BTV died. There are little animals who survived those infection, and the animals who survived the infection has no infection. They are becoming pregnant and gave normal lambs, and that was also the result what I've seen in the practice. In cattle, there are some reports of abnormal calves, but yeah, in my opinion, not so many, but they are reported.
Certainly spoken to Melaholverde Wageningen, they have confirmed some calves born are PCR positive for BTV, but I think the thought is at the moment that those calves clear the infection and don't go on to become PI, persistently infected like BVDV. That's my understanding at the moment, but obviously this is only just happening at the moment, so there's still a lot of work monitoring and documenting that to confirm what's going on. So there have been calves born affected.
Yeah.
We don't know a lot more than that at the moment because this is all happening right now.
Well, there's a further question here about calves born then for Mark. Have you seen any ocular abnormalities like cloudy eyes, as I think you reported in BTV8 outbreak?
Yeah, a few calves, but not so many.
Not so many.
No,
Okay.
not so many.
That's like an
Thank you.
immune-mediated deposition thing,
Yeah.
like you see with the dogs with the CDV with the distemper vaccine. So it's antibody deposition, and it does tend to clear with time.
So this question is, and I think it's referring to those PCR positive calves, and I'm not sure which we could. What abnormalities are they seeing in those? Do you know, either of you?
I don't know.
I've been
Not.
told, and this is not first-hand experience, but you're more likely to either have them clinically normal and just test positive, or like a dummy calf kind of presentation. You don't tend to see the arthrogryposis that you see with Schmallenberg. As to why there is this difference between the two viruses, I don't think anybody knows, but on average, you don't tend to see as much arthrogryposis with BTV, but you can see like a dummy calf syndrome. Most of them, from what I have read and seen and talked to, will be born normal and clear it.
Yeah. Okay, and can you just explain, Rachel, this business, I know we put it in the article about BTV remnants adhering to blood cells for an extended time and the PCR. Can you explain that? You'll explain it better than me.
Yeah, so the way BTV replicates, it will basically stick itself to the surface of red blood cells, that doesn't mean it's live virus. So the red blood cells live for 120 days or so. There's a certain turnover of them. So the active infection in which they're infectious and they actively have virus is probably about no more than 10 days. It'll vary a bit from animal to animal. Um, they will test positive for up to 60 days, though. That will be dead virus that is still stuck to the red blood cells. The viral nucleic acid is still there, and that's what the PCR test detects or picks up, but it's not live virus. So they will test positive on a PCR test for an extended period of time. They won't necessarily be infectious, they're almost certainly not. But for diagnostics, it has certain implications for trade testing and things. Pragmatically, it doesn't mean they're infectious just because they have a PCR positive test, because it goes on for such a long time. And I think that's part of the confusion about the testing of the animals in the UK, because they were infected months earlier, but will still test positive for quite a long period of time. Not all of them, but a lot of them. Does that make
Okay.
sense?
Yeah, thank you. That's helpful. I think I should answer this question. So, do you have any experience with deltamethrin as a repellent to keep the midges off? And we dealt with this 2 weeks ago at a webinar, but also we had a round table. We got all the pharmaceutical companies in together who make all those ectoparasite preparations, and they were completely united in their agreement that there is no repellent or topical treatment that you can put on sheep or cattle that will keep midges away to prevent BTV transmission, because a single midge can transmit the virus. So there has been quite a lot of talk about, can we use repellents for the midges, and there is nothing that has a license to keep midges off, but equally there's no evidence whatsoever to show that that's effective, and partly because in the same way you have to reapply mosquito treatments on yourself on every couple of hours, it's just completely impractical in a livestock situation. So is there anything you want to add to that, Rachel? I mean, they were very clear, weren't they?
Yeah, the biomass of the midges is massive. It's just really huge, and it's on an environmental scale. So what you can do with insect repellents on an individual animal or site, it's not enough to stop them getting infected, and it can't be, because we're just talking a massive, massive biomass of midges, and we can't make a big enough dent on that to make a difference. And there's all sorts of environmental toxicity problems with pouring huge volumes of chemicals around in an uncontrolled manner. It's I know people want to try and want to do something and want to feel that they're doing something, but all the evidence we have is that it's just not going to work for stopping them getting infected. Mark, I don't know if you've got any comments there from the Netherlands experience either.
No, I think the same, and also the discussion what the effect is on the environment.
Yeah.
Yeah. But what is interesting, Mark, and I know Margit said similar, and this is where I think it's worth us talking about. I know your farmers were sure housing animals with ventilation in the sheds was a good way to worked to some degree, whereas I know our midge experts are saying definitely don't bring the animals into the house because the midges will concentrate there. But there is a bit of controversy there. I think it's worth us talking about anyway. There was
I think so.
anecdotal evidence. Sorry?
I think so. I've seen a situation in one of my farms who housed their sheep inside when the first cases of Bluetongue EF, and after 2.5 weeks there were no new cases of BTV. So I think it will help. And alleen the problem is on most sheep farms there's not a lot of ventilation in those barns, And in contrast, I think in the most dairy cattle farms, there's a lot of ventilation. So I think there the combination of housing them inside and also with a lot of ventilation, that will help to prevent yeah, to have the problems because of the midges. But yeah, I know the same discussion with sheep in the Netherlands, but I've seen it in our practice when housing them inside, that on some farms there are less problems with BTV.
I think one of the main things that is going back and forth and gets a bit lost is that ventilation, the airflow is the critical bit. It's not the whether they're inside or outside. If you can get the airflow higher than 3 meters per second, which needs a hell of a lot of fan forced airflow rate to achieve, like we're not talking just leaving them in a barn. It needs very high active airflow. It's higher than 3 meters per second. That's higher than the midges are able to fly against, so they can't settle to bite. And that airflow bit is the really critical bit. Because conversely, the other recommendation, which may be more practical for some herds, is to put them in the windiest spot you have. It is really, really difficult because we're trying to. The midges are also tiny, really tiny. So if you're going to put up netting or mesh screening, it's got to be really, really fine screening. They're much smaller than mosquitoes and they're really, really small. So your typical open flat-sided barn with poor ventilation probably isn't going to help a lot. Like you really are going to have to make it Fort Knox. Like we have that ventilation rate at the CO3 lab, but it costs a fortune to run it in terms of the energy costs, and you'd have to do it for an extended period of time. It's not that you're going to put them in there for a couple of days. We're talking potentially months.
Yeah.
So these are, for farmers, these are practical decisions they're going to have to think about and make advanced planning decisions on, because doing it half-heartedly is not going to work.
Yeah.
But I think it's also can explain the difference between farms, because we have some farms with a lot of bushes around the different pastures, and also we've got a lot of farms with only open pastures, and we see a lot of difference between infected animals between farms in our practice. Dus I think it's also can be a reason for the difference of infection rate in different flocks.
Yeah, and the midges breed in, wet muck heaps and damp environments. So your local environment, whether it's swampy or not, whether it's windy or not, it depends on your midge population, and that's quite hard to manipulate at a short time frame. That's behind the recommendations, at least in your farmyard to get rid of your muck heaps and try and keep the midge numbers as low as you can. That's probably more effective than the repellents. But it's an environmental scale thing, so it's really hard, particularly for smaller farms, to manipulate that enough to make a difference.
Yeah, but also the discussion thing, I think in our practice, because of we are happy it's popular to make some areas wetter than before. It's part of the region in our practice that
Environmental management and flood
yeah,
prevention and all
there's,
those
there's
things,
also
which are good
horrible.
things.
Yeah, it's good for the midges.
Yes.
Yeah.
Okay, this is our last question that we've got here, and it's a political one. So I'm going to give it to you, Rachel. Well, it's why can't we fast track vaccination in the UK now? It's available to a near neighbour, especially seeing the carnage. And I said I'd ask Rachel, knowing she thinks that we should definitely have vaccination, but it is out of our control. The companies, isn't it? At the moment, it's possibly a trade
Yeah,
issue thing.
another plane. But the VMD have stated very clearly that they will fast track it if it's presented to them. And the way our regulatory system is set up, if it passed the EU requirements, which the vaccines that have been presented to the Netherlands. It is an emergency one, but it is in the right format and all the documentation and things that are needed for full registration. It will pass here, or is likely to, but that process still takes time. People have to read the documents. They have to be submitted in the first place. It costs money to do so, so the companies have to pay to do that. People have to read the documents, and we're talking a massive dossier of things. It's not a 2-page job, and they have to assess that and scrutinise that properly. So they were unwilling or unable to give an actual time frame on how long that will take, because that depends on how quickly they can get people and how quickly they can do it. Remember, even for COVID, even given the urgency of the human situation, that still took months, and they're not going to shortcut the safety requirements of vaccines. They're just not going to do that for very good reasons for public trust. So that it's set up ready to go as fast as it can be. There is a separate political decision around whether vaccination will be permitted. That's to do with protection of trading opportunities. That decision sits with DEFRA, with the Chief Veterinary Officer, and to a large extent with the Minister for Agriculture. Ultimately, that is the person that signs that or not. And that's not within our control as scientists. As Fiona has said, that is a political decision. So that's where we're at with that.
Just and one of the other things from a commercial point of view, I think for the companies, is whether in our current
Whether we
situation
buy it.
there would be whether people would buy vaccine. I think it'd be interesting, Mark. Do you have what's the situation with your farmers and whether or not they'd buy BTV vaccine?
Now
I think I know the answer.
the problems are very heavy in our practice. So vaccination is not a discussion in our practice, and there is sort of protocol written which animals we can vaccinate at first, and it is decided to vaccinate the sheep at first because of a lot of problems in those animals. And all the farmers have to pay by their own for the vaccination. So there's not any, how do you call it?
Compensation from the government.
Compensation from the government.
Agreement.
Everything is by their own, instead of the previous outbreak in 2006, 7 and 8. There was a compensation of the government in the Netherlands, but that is not the situation in this year.
So it's a voluntary program, and
it's a voluntary program. And the
and
difference
because of
between
the-
the situation in the previous outbreak, it was a list A disease in the Netherlands, and nowadays it is a list C disease. So the government don't have to deal with the problems of BTV so much.
Yeah, because I think we were talking earlier before this, you said because it's in the emergency registration, it has to be administered by a vet. So while the vaccine cost, I think you said, was probably around €4 a head for sheep at the moment with the current one, there is additional cost for veterinary time. So I know that's a critical question everyone's really interested in, but it won't be significantly different to the UK. Yeah.
Yeah, I've checked the cost of the vaccine, and it is around €3 for a single vaccination.
Okay.
Yeah. So for sheep, it's a single shot. For cattle, they're going to need for the singles, several weeks apart.
Yeah, plus for the cattle, they have to get a double dose of the sheep of the first vaccine, and it seems to be different for the next one. So
one vaccine has a different dose rate to the other, which will likely be cheaper, but we don't have costs on that yet.
Yeah, I think so.
And these it's
Yeah.
not likely to be different in the UK. So that's a kind of about what we're looking at economically. Not who knows what the decisions will be, but if people are thinking or making plans, that's the information we've got for where it's at.
So there are a couple of questions here that I don't think we can answer about. So one is whether the vaccines are being used in Germany, Belgium, and other countries in the mainland. And I think that's the case.
Don't know.
You don't know. Okay. I thought it was the Netherlands have got emergency.
There's an emergency registration in Belgium for the Siva vaccine. I've not spoken to anyone there.
I think the Boehringer one, there's 2 other countries where there's also emergency. I think it was Belgium and Germany, I think.
They only announced that one yesterday, so we haven't had time to run around and find out yet.
And then the question here, which we will, if we get the vaccine, will the government or industry coordinate ring zones? We really do not know the answer to that. So currently, there's a lot of the current situation is more as much political and whether it affects our trade situation.
And
I think
decisions as to whether restrictions are put in place or whether ring vaccination or something like that makes sense depends very much on how much they vaccinate in Europe, because that will limit the size of the outbreak. They go, as Mark's pointed out, they're going as fast as it's possible to go. And when it hits, if it hits in June early, we get a much bigger outbreak and a much bigger problem. And the restrictions and things make a lot more sense for limiting that then. If it hits in September or hits at a very large scale, nothing we do is going to make much difference. So that's, to be fair to DEFRA, that's why they can't give definitive guidelines on what they're going to do at the moment, because it depends and is weather dependent. It depends on how humid it is, how wet it is, how hot it is, because that determines the midge numbers and when the first frosts come in autumn. So we think we probably will have an outbreak. There's so much stuff we can't predict with that, and that's why it's quite uncertain.
But it is very good for us as well. If Mark, if you vaccinate as much as you possibly can, that is really helpful for us.
I think so.
Well, certainly the BTV8, it was very thorough vaccination on the southeast coast of the UK, which protected the rest of the country. So we're in a much stickier position this time because of the state of the vaccine, the timing and everything. But that would be great. I do have a question which I missed, and I think this is probably for Mark, or well, either of you. That in that picture, the map of the cases in the Netherlands, there's very few cases in the south. Is that because you've got less sheep down in the south of the?
No, I think the most important reason is the situation of the wind in the Netherlands. The wind, how do you?
Wind.
Oh, the wind. The wind was pushing the midges north.
Patterns.
Yeah.
Okay.
So when you see the situation in the autumn about the wind, you see most of the situation was to the eastern part of the Netherlands.
Yeah.
That's just seasonal wind patterns, and that's why our south and east coasts here are likely to be the first places that we would see problems.
Okay. That is the end of our questions. I think no one's going to complain if we let them go quarter of an hour early. Thank ever so much, Mark. We really, really appreciate you coming in.
It has been massively helpful to have that straight from the horse's mouth what's happening, because it's such an uncertain situation. It's really, really difficult.
Yeah, and thank you, Rachel, as well for sharing your expertise. So just to reiterate, the recording will be available. Everyone who registered will be able to access it, and it will also be accessible via the Ruminant Health and Welfare Resource Hub. And there are a number of different webinars as well. So if you're particularly interested in reducing midge or doing what you can for midges, then the webinar 2 weeks ago was specifically talking about that. And please do fill in your feedback form. Let us know what else you may want webinars on.
Yes, we will try and keep things up to date as it moves, because it is moving very quickly, and it's really helpful to the steering group to know what things people want and need to know, because then we can try and get you the information we have.
Exactly. There are 3 useful websites. There's the Ruminant Health and Welfare one. You can Google that and it goes straight to Bluetongue. There's frequently asked questions. There's a government website which is really important, how to spot Bluetongue and how to report it, and also updates on what the current situation is in the UK. And the AHDB also have Bluetongue Virus webinar, so place to go to get more information. So there is plenty of sources of information. Please do access them. And so just leave me to say thank ever so much to Rachel and to Mark. We really appreciate it.
Thank you.
Thank you.
Bye.